Welcome to another concussion podcast. And this one is on protecting the brain. It's on hope for full recovery. And it's on educating you about a few different things, especially inflammation and neural inflammation and the brain on fire. So, this is the Dr. M Experienced podcast. Remember, I'm not giving any of you specific advice. I still see patients, I still do consults, but when you're listening to this, this is not specific medical advice. It's information and it's based on my experience with hundreds and thousands of patients, and it's based on research. So, let's get going after that disclaimer. So, no matter how far out someone is from a concussion, there's hope for reasonable and close to full recovery or full recovery. I've seen full recovery in most of my patients. Now, I want to talk about a concept of brain reserve. We're going to bring up a slide to show you on brain reserve, but what this means is remember, there's regions of the brain, and there's many regions of the brain. And did you know that the brain is like a big corporation with there's an accounting part that deals with numbers. There's a word part that deals with finding words. There's a part that deals with speaking words. There's so many different parts. There's the frontal lobe. There's the cerebellum. So in each one of these regions, there's something called brain reserve. What does that mean? Well, if a person gets a head injury or brain injury or an infection or any other reason that the brain can be damaged, brain reserve can go down, meaning the number of functioning neurons and the connections between the neurons decreases. Okay, so as brain reserve can go down, then what we can have is a situation where we have symptoms. And symptoms are at a certain line, and the person has to lose a fair amount of brain reserve to have symptoms. If the person just gains a little bit above the brain reserve, they're going to think, oh, I don't have any more symptoms, and therefore I'm fine. And that is absolutely not true. This is a very important concept in anything regarding the brain. We need to get well above the line of symptoms to a line of like high brain reserve. What does that mean? That means that we have a lot of ability to sustain other issues in our brain. But if we're too close to the level of brain reserve and we get to the level of brain symptoms, then we say, boy, we're having trouble finding words, we're having trouble with the memory. Any of these things can start happening. So one of the goals in concussion care and brain health is to get regions that are not functioning well to the highest level of brain reserve possible. It's a very important concept. The other concept is different regions can be at different levels. Like someone could be having balance problems, so therefore they've fallen below the level of symptoms, but they could be doing fine in finding words or speaking words. So just remember, if we were to map out your brain right now, we could see where you're at each different level, at each different region. It would be actually different. Okay, so that's that concept. Now, another concept really important in terms of treating the brain is protecting the brain while it's healing. This actually applies not only to concussion care, it applies to any brain-based or neurological condition, is protecting the neurological systems, the brain, from further injury while we're trying to heal it and repair it and rebuild it. Okay? So what are we thinking about here? Okay, we don't want someone falling. So that means that you don't want to do something or advise someone to do something where they could fall. So say if they're a skier, say, look, you can't ski right now while you're trying to heal, and especially for the first 2 weeks. But if someone's still having active symptoms, I would call skiing a very high risk activity. Same thing with, difficult mountain biking, but maybe someone could do some biking around their neighborhoods. So we got to protect from falling. Next, we got to protect from electromagnetic fields. Electromagnetic fields, especially radio frequency fields, can damage the blood-brain barrier and the brain. So what's the practical information there? And especially go back to our EMF episode. I talked a lot about this, but just to summarize this, tell all my patients with brain-based issues or post-concussion, turn off the Wi-Fi as much as possible, but don't sleep with Wi-Fi. Number one. Number two, keep the cell phone away from the head. If possible, turn it into airplane mode or just keep it in another room. Okay. Number three, no Bluetooth devices near you or coming out of your ears, or even did you know that a TV remote control is a Bluetooth device? So we just want those things as far away as possible. Also, no active electronics that's emitting, fields should be in the bedroom. That includes like an Apple TV or Alexa's or any of these things. They need to be shut off, even unplugged. Okay. And even Apple watches should not be worn at night. They emit large electromagnetic fields. So that is the whole principle of decreasing these fields, the EMF, but especially the radio frequencies. Okay. Now, we want to limit neurotoxins. What does that mean? Well, there's all kinds of things that are toxic in foods. So we want to limit fish that have high mercury levels, big fish. We don't want to have much food that's browned. That's called advanced glycosylated end products. So we want to limit that kind of thing. So when you make eggs, which are extremely healthy for the brain, don't brown them and don't brown other things. We also want to not have chips and crackers and other things that are already overcooked and browned. What else? We want mostly organic and GMO free food. Why? Because we're going to decrease the neurotoxins going into the brain. Okay, so what else? If someone's going to wear a helmet when they get back to activities, we want it to be the safest helmet possible. What might that be? If it's biking, it's going to be a MIPS helmet or something called 6D. 6D is a company that has a technology with 2 shells in their helmet. I don't think they produce a ski helmet yet, but they definitely have bike helmets and motorcycle helmets. So that's called protective gear and protective gear on the head. And of course, avoid contact sports until you're fully better, the individual person is fully better. Okay? So now we're going to talk about individual things regarding studies. What about these studies? When I talk about studies, you need to know that most of the studies have been done on rats and mice, not on people. There have been studies done on people, but the studies done on rats and mice that I've reviewed, we have to change the doses of whatever they're using, because sometimes the doses for rats and mice have to be divided by 6 to 12 to get the effective dose for humans. Okay, now let's talk about excitotoxicity, because that's easy. We can deal with that quickly. What is it? This is a mechanism that I talked about in the first episode on concussion. It goes on within the first few weeks after a head injury. The interesting thing is it can keep going on. What is it? NMDA receptors, which are certain receptors on the cells, if they get oversensitive or there's too much glutamate around, can let too much calcium in the cell, and then the cell could be damaged beyond repair and then die. It's called excitotoxicity. Now, what's interesting is there's a neurosurgeon that wrote a book called Excitotoxicity. He wrote it many years ago and introduced a lot of people to the concept of excitotoxicity. He talked about MSG and other things that can trigger the brain and damage neurons. So, what do we want to recommend to limit excitotoxicity? We want to recommend certain types of magnesium, especially magnesium threonate. Sounds like threonate. Magnesium threonate is especially useful because it goes into the brain better and can control excitotoxicity better. So everybody after concussion should be on magnesium threonate. If they can't afford it because it's a little more expensive, they should be on at least 400 to 600 milligrams of magnesium and hope that enough of it goes in the brain. What else? We want to decrease things that trigger excitotoxicity. So if someone wants to chew gum, it's got to be sweetened with xylitol. That is an X. And then you want to go on the internet and look for hidden sources of MSG. We don't want MSG in foods for anybody with a brain-based problem, period. Okay, so how much magnesium glycinate? 144 milligrams 2 times a day. That would be a very good dose for that. Also, riboflavin is a B vitamin that can also be used for excitotoxicity. It might have an additive effect with magnesium, this type of magnesium, and I usually recommend 75 to 200 milligrams a day. So that is the excitotoxicity piece. Let's move on to a concept which we call the brain on fire or brain inflammation. What is responsible for it? What's the deal? What's going on when we hear this? Okay. Now, let's talk about what the cells are. The glial cells are the support cells. 90% of the brain are support cells. Okay. They're called oligodendrocytes, microglia, and astrocytes. I'm going to really focus on the ones that are called microglia, but astrocytes make up the blood-brain barrier, and oligodendrocytes produce myelin. They can all be injured after a concussion, and they can be injured in other brain-based things too. Okay, so let's talk about microglia. Okay, they're just smaller glia. They're a type of glial cell that has arm-like projections, and we're going to show you a slide of this, but they have arm-like projections. And one of the reasons they have these arm-like projections is they actually trim synaptic networks. What does that mean? They're pruning them so that the synapses work better. So a microglial cell that is fully functioning can actually move around in the brain, can trim synaptic networks. What else can it do? It produces growth factors like BDNF, brain-derived growth factor, nerve growth factor. These growth factors are like fertilizer for the brain. They're extremely important. You want your microglial cells, and you want the microglial cells of anybody that had a concussion to be working properly. I'm going to be talking about that. Okay. Now, if a person is in a concussion, certain regions of the brain can be damaged, and those microglial cells can be activated or primed. There's different words for this, which means they get damaged. Then what can happen? They can go into a different phase called the M1 phase. They can lose their projections. They can't move anymore, but they either can do one of two things. If they're in the M1 phase, they produce inflammatory molecules. They can damage the brain. They can actually engulf neurons and destroy them. We don't want M1 activated microglial cells in the brain for very long. We might want it for a period of time, especially if there's a brain infection, to protect the person or protect us. But we don't want them in there, on a chronic basis. Okay, so what's interesting is inflammation gets involved to clean up the debris of the tissue that's damaged after concussion. But we don't want inflammation to continue indefinitely. In other words, this inflammation might be thought of as the repair crew that comes in. We don't want the repair crew working overtime and for months and months and months. That would be called neural inflammation. And then we have what's called microglial activation. We have too many of the microglial cells in the M1 phase, and we got a problem because we got chronic inflammation that could lead to dead neurons, neurons not functioning properly, not enough growth factors, synaptic networks not being trimmed, the whole works. Okay, so what's one of the goals? Get the M1 microglial cells to the M2 phenotype, meaning at least the type that produces the growth factors and anti-inflammatory products. Okay, so that's a big deal. It's a big goal, is to control neural inflammation after a concussion. What can we do to create a shift from an M1 microglial cell to an M2 microglial cell? There's a lot of information about trying to create this shift. So let's talk about this. There's certain flavonoids that we can get either from food or herbs that can help create this shift. And there's other things that work on it too. I'm going to tell you what can help create the shift. Luteolin is one thing that can help create the shift. You know, the other thing about luteolin that's interesting is it can stabilize mast cells. So it could be a double tasker because we can have mast cell issues and mast cell activation after concussion as well. But luteolin can help, and there's a supplement from a company called Algonaut, and we're going to have it in our list here. I usually use the product called FibroProtect because it's got the most luteolin in it, twice a day. Now, from food, we can have apigenin, APIGENIN. Best food source is parsley. So I say, forget the kale smoothie. You're going to do the parsley smoothie, and you're going to put like half a head of organic flat parsley in your smoothie along with frozen blueberries because those have the blue pigments in them. So the best way to get apigenin is either take a supplement of apigenin. There is a company called Do Not Age that has 500 milligrams of it, and I do really like that product. Or make sure you get parsley in your diet every day from a smoothie or from a parsley pesto. Vitamin D can also help the shift, so we want to make sure that anybody that had a concussion or brain-based issues is got a vitamin D level at least 50 to 60 and is supplementing with at least 5,000 international units. Now, what else can contribute to brain inflammation? Insomnia. And you want to listen to our podcast on insomnia. What I indicated there is anybody's getting 6 or less hours of sleep, 6 or less is going to have brain inflammation and body inflammation for 4 days. So it's essential for people after concussion, or people trying to heal their brain, get 7 or more hours of sleep. And so I go into a lot of this in that podcast. So I'm not going into it here, but there's some great information in that podcast on how to accomplish that. Okay. But just limit the caffeine also. No caffeine after 12 noon. Blue light blocking glasses. There's so much information there. Okay. Now, another thing we could do to decrease brain inflammation is activate NRF2. It's a gene response to produce the body's own anti-inflammatory molecules. The other interesting things that it does, it produces the body's own antioxidants. What can a person do to activate the NRF2 pathway? Well, you can drink green tea, but they don't want to drink much green tea afternoon because it might prevent them from sleeping. Broccoli sprouts can help activate it. Turmeric can activate it, and there's a big role for curcumin and turmeric to decrease brain inflammation. Also omega-3s, DHA, can activate NRF2. So that can be very important in terms of decreasing brain inflammation. Now, I want to talk about curcumin because there's a lot of misunderstanding about this, but curcumin is a supplement that's derived from turmeric. It has to get in the brain for it to really function to decrease brain inflammation. There is a form of curcumin called the Longvita form that passes the blood-brain barrier, is very good at decreasing brain inflammation. There's a number of sources for this, but the dose is 400 milligrams twice a day in an adult, 200 milligrams 2 to 3 times a day in a kid. Now, what do I like for that? There is a product called Cogumin by a company called Protocols for Life. We're going to link to that in our affiliates. And that's an excellent product. It's the Longvita form. I've used it for years on my patients. For kids, there's a gummy, believe it or not, that has 100 milligrams of Longvita curcumin. And we want kids chewing 2 of these twice a day, up to 3 times a day. It has only 100 milligrams per gummy. The gummies taste like mango. They don't have much sugar in them. It's a great way to help with healing the brain in terms of inflammation. So the other thing that helps decrease inflammation is omega-3s like EPA and DHA. And DHA is very important for neurological membranes. I'm going to be talking about that a lot more in a future episode. And just remember that curcumin has other effects other than just um, decreasing brain inflammation. There's a lot of other things that it can do. So I want to thank you for listening to this episode. Remember again, I'm not telling people what to do. I'm giving information based on my clinical practice. Always listen to your healthcare provider, but remember, I've been treating concussions for many years, devised a pathophysiology-based program. That's why I'm talking and educating people about this. Look forward to seeing you in our other podcasts. And don't forget to check out our affiliate page. We got a whole brain-based section. We got the doctor supplement store that has my brain-based protocols. So check out our affiliate page.